COVID-19 vaccine. Should you take it or not? Well, since we're a financial channel, we're going to talk about the impacts of the vaccine, whether you take it or not. So let's dive right in. According to public health experts, 15 to 20% of people who get COVID-19 and seek treatment may need a hospital stay for the disease. In a recent brief, Fair Health studied what the cost of those hospital stays might be. They estimated costs based on ICD-10 procedure codes, which are codes that hospitals and healthcare companies use for billing purposes, as well as revenue codes associated with flu and pneumonia. They analyzed data from a database of over 30 billion private healthcare claim records, which is the largest such repository in the country. They found that the average charge per COVID-19 patient requiring a hospital stay to be $73,300. That charge is the estimated cost for a patient with no health insurance. It's also the cost for a patient seeing an out-of-network provider and whose health plan has no out-of-network benefits. The average estimated in-network amount per privately insured patient is lower, at $38,221. The in-network amount is the amount that the providers in the plan's network have agreed to accept as full payment. It includes both the amount the plan pays and the amount the patient pays. The amount the patient pays is based on the cost-sharing provisions of the plan that the patient has. These numbers are useful to know to help you understand how much the COVID-19 pandemic is costing people in our country. But it's also important to know that they're not the actual amount you're likely to have to pay if you or someone you know gets COVID-19. If you have insurance, your costs will be determined by the cost-sharing terms of your health plan. If you don't have insurance, costs will vary based on your specific case, and you may be able to negotiate a lower amount with your providers. But no matter what the cost, even if your insurance charges you nothing, the amount of time lost in this process is something that cannot be earned back. On the flip side, the cost of the COVID-19 vaccine is, wait for it, free for anyone to take, no matter if they have insurance coverage or not. Under the Coronavirus Aid, Relief, and Economic Security, or CARES Act, which was signed into law in March of 2020, the vaccines are free to the public. So, who is paying for the vaccine? Well, you can thank the federal government for picking up the tab on that one. It invested $10 billion in research, production, and distribution of the COVID-19 vaccines. Will the vaccine always be free? It will be free from 2020 and 2021 as part of the public health emergency. But after that, it'll probably become like any other vaccine, and there will possibly be charges for it. Now, a lot of people are debating whether or not to get the vaccine. Well, depending on which priority group you fall into, the real question is whether you can afford not to. Well, thank you so much for watching. I hope you found some value in this video, and if you did, please hit the like button. It would mean a lot to me, and hit the subscribe button for more videos. See you next time on Dan Daily.